Akuma sana simo. Maye nyunyo minyakupo. Yemelina sona misakeyo.
London, it's your time and your turn. Shades of Grace Movie Premiere UK 2024, taking place at the Odeon Cinema, Greenwich, Buxby Way, London, SC10 OQJ. Grab your tickets at www.dpgministry.com. It's happening on Saturday, 25th of May 2024. London, it's your time and it's your turn. We can't wait to see you there. It's going to be an amazing night. You can't afford to miss this. To God be all the glory.
Onye cash, chopping and spending the cash. No mercy for money.
You don't cost. Last.
Now everybody go shop breakfast. Ayo.
See with the eye of the spirit, and I can tell joy is far from you. Prayed, you have wept, you have fasted, you have travailed. Now it's time to rest in the faith that God is not a man that he should lie.
Hello everyone, my name is Diana Hamilton. I'm excited to let you know that come the 27th of April, I will be at Kent Worship here in Kent in Gillingham. So make a date with us on the 27th of April, 2 p.m. sharp. The event starts. The venue is the Mid-Kent College Medway campus, and that's in Gillingham. Make your way there on that day, the 27th of April, 2 p.m. Let's worship God. Let's bless God. My name again is Diana Hamilton. The date is the 27th of April. The time is 2 p.m. and the event is Kent Worship. God bless.
Hello, this is Lawyer Wisdom of Wismart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
Buy an interest-free home and pay within 36 months. Yes, Daimler Homes' new gold standard development, Kilton Court, has just commenced, and you can own a unit now and pay within 36 months without any interest. Starting at 95,000, you can own an elegant apartment. And guess what? Discounts are available from now till end of May. To learn more, visit our website at daimlerhomesgh.com or call us on 0200-584-558. Daimler Homes, the elegance of living.
Hello everyone, I'm Anne, and we are called the Oasis, and today we will be talking about the UK government's new Pharmacy First scheme, and we are going to straight away get into it. And first of all, I also want to apologize for not being here last week. I was down with the flu, but my co-host Akwesha held the fort down, so today I'm back and better. And now, without further ado, let us invite the gentleman who is a lead pharmacist and is going to lead us today in our talk, Mr. Kojo Amoako.
Thank you, Abena, and of course, thank you. So, good evening, everyone.
But Kojo, before you start,
obviously, I know you're probably going to do it anyway, but we just want to obviously, for anybody who's new to the show, sort of explain how the show works and, you know, what's going to happen. So we've got obviously myself and Abana, we're the hosts for the show. I'm a doctor, so sometimes I chip in into some of the things as well. Abana asks us all the questions. And then also, as Kojo is giving us presentation, please be putting down anything that you hear that you don't really understand, or anything that you would like some clarity on, just put it down, because it will come to question time and then you'll be able to ask them your questions. And also, it's not just about the topic we're talking about today, it's also about any general questions. So any questions that you have about medicine that you'd like to ask, this is the place to ask. Abana, did I miss anything?
No, you have not. Yes, I am not a doctor, so I do not and will not be answering the questions, but I will facilitate the questions for the experts, which is Dr. Akos and Ms. Kojo Amoako, to answer today. So without further ado, shall we?
Please, Kojo, tell us more about yourself and what you do and why you're here today.
Okay, so I'm a pharmacist with about 17 years experience behind me, spanning from medicines regulation to hospital practice and now community practice, and still learning every day. So currently I work in an online pharmacy called Medical to You Pharmacy, and that's where this service is being delivered from as well. So we do have this service there as well. Can everyone hear me loud and clear though? Okay. So I'll just jump straight into it because it's quite brief. Prior to COVID, every UK resident needed antibiotic to get box standard antibiotics and antivirals for very common infections. But I think COVID and so many other pressures on the NHS got the government to rethink. And what they've done with this scheme is that they've selected 7 very common infections that by the time we go through it, you would know how common they are. And they've kind of changed the law to allow pharmacists to be able to diagnose these conditions using their clinical expertise and then prescribe or give out antibiotics as well as antivirals there and then, so that patients can start straight away the treatment. And it's got so many advantages. It frees up GP time to do other very serious conditions. And also patients get to start their treatment on time as well. So the 7 main conditions are earache, which technically Dr. Kosia and her colleagues will call it acute otitis media. Then we've got impetigo, which is a very common skin infection, especially in kids. Then you've got infected skin bites as well. Then you've got shingles. Then you've got sinusitis. And the last 2 are sore throats and uncomplicated UTIs, urinary tract infections. So I'll first want to start with impetigo, because that seems to be one of the very common ones. So generally, these are lesions that normally happen around the mouths of people, kids usually. Don't know if everyone can see this. They're quite golden, crusty in nature.
Should have given a disclaimer there, because some people might be eaten.
I'm really sorry to come to your homes with this. So in a typical Caucasian, it normally shows like this, quite soft. The age ranges are usually from 1 year and above. You kind of see this quite often happening. Let me try and bring a dark-skinned one as well, so that some of you can be more familiar with it as well. So in dark-skinned people, you can see it like this as well. Again, sorry to come to your homes with this. But basically, when you walk into a pharmacy, I forgot to mention that you can self-refer. You don't really have to be referred by a GP or 111 before a pharmacist sees you. As you all know, you can just walk into any UK high street pharmacy And once the pharmacist realizes that you are taking some of these inclusion criteria, he will just go around that along that pathway, clinical pathway, and then start treating you. So the first inclusion is we cannot treat people who are less than a year. So babies are still left to the doctors to deal with. And the lesions have to be localized. You see, normally it's around the chin, the nose, and the mouth. And it's normally not that many. And once they are happy with that, using their clinical knowledge, when they see one, they can see it. They will then give you a cream. If it's fewer lesions, 3 or fewer, they will normally give you the 1% hydrogen peroxide cream. If it's more than 4 lesions, they will give you fusidic acid 2% cream. And if it's quite pronounced, they will then give you an oral antibiotic. And the advice is, once you go home, you leave the pharmacy. If it should get worse suddenly or rates, you need to go back to a doctor for the doctor to have a proper look at it again for you. So again, they've given a few exclusion criteria. So just because it's impetigo doesn't mean that the pharmacist will treat you. They've been given a few pointers, people that they shouldn't treat. For instance, if you've been given one of these creams for the same episode already by a doctor, they will never give you that again. If you've been given oral antibiotics within a certain time frame for whatever condition, again, they will not touch it. If you've had more than 2 episodes of impetigo within the same year, they are advised not to touch it. And so, you will still have to go to a GP or a hospital doctor and get treated. So that's that for impetigo. The second one that we'll have a look at is shingles. I think in our local Twi parlance, we say anansi. So it's normally under this scheme, you have to be more than 18 years before the pharmacist will have a look at it. They are not allowed to look at younger age ranges for obvious reasons. And depending on the onset of the rash, if it's less than 72 hours, they're quite likely to give you, a very common antiretroviral drug. But if it's more than 7 days and you take other boxes, they're quite likely to give you something else as well. So as many of you may know, shingles is a reactivation of a previous chickenpox infection. So it's not something that you should be really, really, afraid of, as we were made to believe when we were younger. Anansi is not that, who is not meant to kill you. The pharmacist will make sure it's not in your trunk. It has to be around your neck and your limbs before they can treat it as well. So there are quite a few things. So don't get too offended if the pharmacist still sends you away. It's just for your own good to make sure that the doctors do, other assessments before they prescribe antibiotics, that they are allowed to prescribe, all in your own interest. Again, if you are breastfeeding or you are pregnant, they might shy away from it a bit as well, as the law, allows them to do. And if you are immunocompromised, they may also not be so keen to help you. So when we say immunocompromised, you are taking medicines that affect your disease fighting capabilities. So you're not as every other person. So you have to be treated a bit differently. So they will have a look at that. So that's the second condition out of the 7. The next one will be sinusitis. When you have a very typical blocked nose, you can't do anything after trying the bog standard cold preparations over the counter. Nothing is working. The pharmacist might have a look at it, and they are allowed to give you steroid sprays, and in very worse conditions, add antibiotics as well. Because whereas these are viral, if it carries on for a long time, some opportunistic bacteria also take advantage and get in there. And it is believed that if you treat these early, you're more likely to get better outcomes, and you can go back to your normal activities as well. So sinusitis is one of that. Again, the pharmacist will not touch you if you are on steroids. Some people take asthma pumps, the brown pump for asthma to prevent it. The pharmacist will not touch you. If you take oral steroids for whatever reason as well, they are not really allowed to give you any of these over the counter. Again, if you've been given any topical steroid for eczema or anything like that, because some of it end up getting into your bloodstream, they may also not treat you under this scheme as well. If you got bleeding nose, got blood coming out of your nose as well, they are not really encouraged to treat you under this scheme. They have to refer you to a doctor. And lastly, if maybe in the past you've been given a steroid spray for the nose, which did not work, again, they will not give it to you. So there are so many exclusion criteria to this. So when you go in there, the pharmacist by law will have a good look at all these things before they treat you. The next one that pharmacists can treat under this scheme is uncomplicated urinary tract infections. So they will be very keen to distinguish complicated ones from uncomplicated ones. You have to be a woman. They cannot treat men under this scheme. So sorry, guys. And even for the ladies, you have to be between 16 and 64 years. They are not allowed to treat younger ladies and very old ladies as well. You cannot be pregnant during the time that they are trying to treat you under this scheme. You also cannot be breastfeeding. Then you shouldn't be somebody who takes antibiotics for UTI prophylaxis. So if you have a history of recurrent UTI such that your GP has put you on antibiotics on a normal day, there's no way that they would treat you. Again, the pharmacist will also attempt to exclude what medically we call pyelonephritis. So if you've got any nausea, very severe nausea, an urge to vomit, the pharmacist will not be keen to give you. If you turn up shaking, it's very unlikely that the pharmacist will touch you. And lastly, if you've got really high temperature, around 37.9 degrees Celsius as well, we'll leave you for the doctors to do their thing as well. But it's good to know that most people who turn up in pharmacies usually don't have any of these exclusion criteria. And so they walk out of the pharmacy with their pack of medicines and start treatment right away. The next condition that we treat under this scheme is sore throat. In a very advanced one, it becomes tonsillitis, quite inflamed. You cannot swallow anything whatsoever. You have to be more than 5 years before you can qualify for this scheme. And the fever, it should come with fever and other severe pain symptoms before the pharmacist will touch you, because they have to distinguish between a full-blown tonsillitis, from a normal, minor oral throat infections, which will self-resolve on their own anyway. If you are taking medicines that interact with the ones that are prescribed under this scheme, again, they are not going to treat you. If you've got your tonsils removed in the past surgically, they will never touch you. And I think this one is very important. If you've had oral typhoid vaccine within the last 3 days, or you have an appointment to have an oral typhoid vaccine within the next 3 days, again, the pharmacist will advise that you're not given this kind of treatment. But 9 times out of 10, most of us will qualify and will walk out happy. The next disease is infected insect bites. So you have to be more than a year before you can qualify for this scheme as well in a pharmacy. And the pharmacist will try and distinguish the bite, make sure it's not a very exotic, insect from the UK, the ones that we normally see around in our gardens and in our parks. So if you've recently traveled outside the country to, say, Ghana, and you come back with a sort of peculiar bite, you would realize that the pharmacist might not be so keen to treat you under this scheme as well. It doesn't have to be an animal bite. So if a dog bites you as well, there's no way you will qualify. You also make sure it's not, permit me to say, a human being, like a human bite as well. And once you qualify, they will make sure that they treat you. So they won't treat the bite. It's not all insect bites that they will treat. But if it's infected, then they will treat you. So they will want to see pus in it, all the cardinal signs of infections, some sort of inflammation consistent with infections before they will treat you. Usually it's a penicillin, a broad spectrum penicillin, but if you're allergic to it, don't worry, you've also got so many other options that they would use. So that makes it 6 conditions. And I believe the last one is otitis media, acute otitis media. So it's normally common in kids. And for the older kids, they'll come to you saying, for those of you who have children, got an earache, it will be pulling and tugging their ears. You would see it would affect their appetite. They really don't want to do what they normally do. You wouldn't see them running around. And your first sign will be wanting to go to the doctor. Well, under this scheme, you can try the pharmacy. And if the pharmacist uses his otoscope, to get down, look at the child's ear, and really it has all the signs there, you will get a course of antibiotic from there to start the treatment straight away. They will make sure that it's not something that will self-resolve, on its own before they would give that to you as well. So I think in a nutshell, these are the 7 basic, very common conditions that prior to this scheme, we used to run to GPs and plug their appointment diaries for treatment, that now, thankfully, we can all go into pharmacies and get treated. I just need to add that for the last one, because there's a need for the pharmacist to look into the patient's ear, we cannot go to an online pharmacy. It has to be a normal brick and mortar pharmacy in the UK for this to happen. And all the examples I use are UK experiences. So for those of us joining us from outside the UK, I'm really sorry, but this is more UK bias. Thank you. And we would now welcome some questions if there are any.
Thank you, Mr. Amoako. Once again, 20 minutes is never enough to do justice to these topics. We will go for a quick break, and then after that, we will come back and we will answer any questions that are available. We'll ask once again. Questions can be solely based related to this particular topic, or any medical or health related question is also welcome. So we'll be back after this short break. Thank you. Short break now, or maybe we just take questions now. I think we're having some technical difficulties, so okay, that's fine. We'll just go straight to questions. Before we go to questions, there was something that I did want to touch on, and I've actually just been reminded, so thank you. I can see Pascal, your hand is up, so we'll come to you in a second. But just in light of what's been going on, I think there was some breaking news in Ghana
just this week, and we had one of the famous gospel artists who passed away and he had G6PD, but I think they're thinking that the cause of death was kidney disease. So we wanted to maybe touch on that as well and just answer any questions that anybody had if it came to things like G6PD or kidney disease. So like we said, this is just a general health talk, so you can ask any questions. But the main thing that I wanted to say, I'm not going to take away from today. I was going to do a little talk on kidney, but I thought that might overshadow the talk from today. So we'll stick to the pharmacy talk today. But it's just important to note that we obviously, Mr. Amoako, our pharmacist, just talked about UTI, which is urinary tract infection. And a complicated urinary tract infection can lead to kidney problems and kidney infections and kidney diseases. So it's also worth, if you've got any, symptoms for urinary tract infection or any concerns about urinary tract infection, it's important to go see a health professional. You can always start with a pharmacy and then obviously go to a medical professional if it's recommended. So that's all I have to say. And if you have any questions, please do let us know. Abana, do you want to start with the questions?
Yes, and if Mr. Amoako would please show his handsome face for our viewers once more. Thank you. Our first question, we've got Pascal.
All right. Thank you very much, and good evening to every one of you. Fantastic delivery by Kojo Amoako. Very, very insightful. Very, very insightful. Thank you for sharing this wealth of knowledge. I hope I really listened well. There's a question around exclusion criteria for male around UTI. I was just curious why male. Sorry if I'm so biased, but that's my question. Thank you very much.
That's our points. So I think basically for UTI in men, okay, so UTI in men is not as common as UTI in ladies, and it's more complicated to treat UTI in men than ladies a bit as well because of our physiological nature, how our physiologies are. So I think the drafters of this scheme thought it wise to make sure that the one for men is not one that we treat in pharmacies as well. That's all I will say. I hope that answers your question, Pascal.
Yeah, I mean, just to add to that, so any UTI in a man is complicated to begin with anyway, because for females, we have a short urethra, so the tube which goes from the opening of where you're peeing to like your internal organ, which is your bladder, in females is shorter. So it's easier for infections to go up to our bladder and for us to get UTIs. So that's usually when a female gets a UTI, it's like, oh, as normal. But if for the guys, the tube going from the tip of the penis to the bladder is much longer. So for the bacteria to actually travel all the way up and get there, there are usually some physiological or some abnormalities which allows that to happen. So when a guy gets a urinary tract infection, it's usually because there's some underlying condition. So it's usually complicated from the beginning. And that's why even in the hospital, other professionals can like fit catheters in females and things. But when it comes to males, it's usually done by a doctor just because of the way that males' physiology works. So that, yeah, you guys are special. Let's put it that way. I think our technicalities we're back on track. So I think we can go for the commercial break now. But just remember that if you have any questions, think about it, what we've spoken about, or any personal health questions or anything, a friend's question, whatever. This is the health talk and all medical questions are welcome here. So after this short break, we'll be taking more questions. Thank you.
Makuma sana simo Mayeye nyunyo minyakupo Yemelino sona misakeyo
London, it's your time and your turn. Shades of Grace Movie Premiere UK 2024, taking place at the Odeon Cinema, Greenwich, Buxby Way, London, SC10 OQJ. Grab your tickets at www.dpgministry.com. It's happening on Saturday, 25th of May, 2024. London, it's your time and it's your turn. We can't wait to see you there. It's going to be an amazing night. You can't afford to miss this. To God be all the glory.
Onyeji cash, chopping and spending the cash. No mercy for money. You don't cost, last. Now everybody go job breakfast. Ayo.
See with the eye of the spirit, and I can tell joy is far from you. Prayed, you have wept, you have fasted, you have travailed. Now it's time to rest in the faith that God is not a man that he should lie.
Mr. Mankwa, me office was any scabania de any project no. As to the be a me office kamania wo problem.
Enemremu. Na monte tap sending kan.
No so ne de.
Tap send ye easy, fast and secured way. Ubetimi send this free amanone. Aba Ghana bank account and as a mobile money account. Untia transfer fee bia.
Sir, I obey any say.
Chene se won ko App Store na Play Store. On download the tap send app no. Or download ya. Ebebu sanso promo code. Oma de pet TV shim. Obenya €5, £5, and answer $10 on his first transfer.
And you make kwa friend a catch them.
Tabi minyanwe. Esansa tap send at the good news aba. Tap send the gina customers wunti or the tap send wallet aba.
I know about any say.
So your customer who UK sia. Ubetimi akọ tap send app no create wallet woso. Enti se rate ne kosora now the sika ko gu wallet no. Anase mpo betimi atususu nkakra enti abre sema opeso send sika ba Ghana no anse wa send sika na ba Ghana anase oba o my Ghana mu a watimi ayusu sika e wo wallet no tie
and you said to say you use momo Ghana hey no
sa pepe se see tap send that trena shim kopiem wo United Arab Emirates, Netherlands and Austria. Tap send na papa no.
Thank you all. We want to thank our recurring viewers, our faithful watchers. We also want to acknowledge our YouTube and Facebook live watchers as well. It's now time for questions, and we would like to encourage questions to come from both YouTube and Facebook. They're being monitored. But and I can't a lot of brofo. You treat 2x4, you'd be film 1-2-1-2 kakrantim patcham franchise. You were not so fluent with the tree. It's now time to ask questions. I've got a few questions here that I can start with. Mr. Amoako Mpacho, I've got a question here which says, when a person comes to the pharmacy, if we can't be treated, we'll be referring back to the GP services and I say, go straight to hospital.
It will be to the GP, depending on the severity. If it's something that's very severe, you're taking the signs of a more severe issue. If it's a GP cannot handle that, it will be to the hospital. But most of the time, it will be to a GP.
Okay. We've got a hands up from Tilly.
Tilly,
did I say your name right? Tilly?
Yes.
Our faithful watcher, welcome back. We're glad to have you here.
Thank you very much. I wasn't here when the program started, but I have a question. It's to do with pigmentation. Is there anything you can recommend? I'm a very fair person, but recently I realized I'm having that and it's really frustrating me. Is there anything? Do I go to the pharmacist or do I see a GP for it? Is there anything you can recommend, please?
Tilly, is it on your face or your whole body?
No, it's on my face.
Okay, mainly on your face. Okay.
Yeah.
It's quite difficult to just make a recommendation, but it would be good to see what it is before. So I would say pop into a pharmacy. Where she looks at it and thinks, it has to be a doctor, a dermatologist, that referral will be made.
All right. It's not a spot, but I realize part of the skin is getting a bit darker, then some are very normal skin, but the darker is becoming more. And it is,
Yeah, it's without seeing it, it's a bit difficult to make a recommendation. So just have it in the pharmacy. Yeah.
Okay. Thank you very much. Thank you.
I mean, red flag symptoms to look for is if you're having any itching, bleeding, any discharge, things like that, then I would go straight to the GP. Am I right, Kojo, or you guys? Because I think because anything like that, you would refer straight to, from the GP would refer straight to the hospital if they were concerned about it. But if it's just the difference in color, then I think, like you said, you can go to the pharmacy. Yeah,
it's just a difference in color. I would do that. Thank you.
No problem.
Fantastic. We've got Liz.
Dr. Koshiani sister Abnami mom. Today I don't even know if my sister Naomi is here, so let me go straight to
Liz Akwaba, we are happy to have you. Faithful watcher.
Who said sister Abnami Munati or to make us a come? Yes.
And then
Ekoye. Jonas in Sunyama, and me some question quickly. Mr. Amoako Pacho, pharmacists to me referral straight to the hospital, or it should be the GP before the hospital?
It's usually the GP before the hospital if it's not urgent. But if it's life-threatening, the pharmacist will ring an ambulance, not be picked from pharmacy. But when it comes to non-urgent referrals, they are a GP nurse letters.
In teachers, no more share the corona. Then you decide whether this is life-threatening or the person should go back to the GP, and then the GP.
Absolutely. But no one can.
Yo, me that's it.
But I think the important thing to also note there is that you don't always have to go to the GP when you visit the pharmacy. So I think, almost say in the beginning, but conditions be or hard to say cold, sinusitis, just a stuffy nose, earache, urine infection. It may be a pharmacy may prescribe you a Dronamol straight ahead. So after you see the pharmacist, you will not be re-referred to your doctor, or you wouldn't have to go to the hospital because the pharmacy will give you the medication to treat you. So it basically cuts out having to wait for the GP. Because now saying when you call your GP, they tell you the 2 weeks appointments, which you're crying on 2 weeks. Sometimes it's 4 weeks appointment, 6 weeks appointment. So depending on what it is, the pharmacy can be quicker. Same day, you go, you get the medication, you're out. So it's nice and quick. So so we should utilize the pharmacy more.
Thank you, Dr. Akusra.
No problem.
Make come say, UK, so you don't pay prescriptions because one form of exemption or another under this scheme, that exemption still applies. Into you'll be a normal, you don't pay for medication. Don't think they will call pharmacy internal. You have to pay. If it's under this scheme, the pharmacists will apply the same scheme and your exemption will apply as well. Into patronizing of that's it.
Nice. Pesho, I have some questions here. I'll start with see earache. Into what kind of earache? What's the question? Because that's going to be some. Into what kind your friends say constitute or qualifies for it? Like ringing in your ear. What kind of pain? And your friends say pharmacist no ever check it.
Okay, so the thing is, there are so many things that can cause earache. Now, the pharmacist will only give you medicines under this scheme if it's really otitis media. Inti obefim no share or this otoscope in the besham, no, I share with eardrum. Depending on how your eardrum is, if it's perfect, or catch yourself, but more than bear with it. If you're more painkillers, I'll be start self-care just to make you comfortable because he knows it's a minor thing that would self-resolve. But wasunum na ofisa with tympanic or eardrum no, a rupture and I say I am infected, consistent with otitis media, then obema antibiotics. And that's why it's important say you don't just overrule any earache. Whenever you are concerned, just pop in. The pharmacist is a professional or the tools to be able to look into your ears. And if it's the type of earache, a qualifying that this came out, or be sorting it out amount. But if it's not, or be reassure, if you are recommended minor things, with immediate self-care will fee. And that is how it is. It's quite difficult because earache, it's earache. Until say your ear is checked out, it's quite difficult to differentiate between the one that you should worry about and the one that you shouldn't. I hope to have answered the question.
I believe you have. Dr. Ako, is anything to add?
I just have a question. I don't know if you have a follow-up question because people were time messaging me about anemia. I feel so hard apart. I have to ask again, but it's a question about anemia. So are you asking a follow-up question or can I go?
No, I wasn't going to ask that. I was just going to ask about the chat. Just to bring, this is a quick one in the chat. When does the new, your friend is saying, when does this new scheme or change take place?
Oh, it started on the 3rd of January. So it's already started. So the whole of February, March, we are already 2 and a bit months into it. It's ongoing.
And how's the uptake been? Have people been using it?
They have. The uptake has been good. But there was an article in one of the weekend magazines. Actually, I think I saw 2.8 million. I stand to be corrected. About 2.8 million consultations nationwide. Yeah.
Wow.
Which is not too bad. Yeah.
You see, it's because we've been starving. See, people are on a waiting list for their GP, and so it's good to hear Salman for take. And just a reminder to everybody who's here, for those who are not from the UK, which this might not be relevant to you, this pharmacy fest, but remember that this is a health talk and that general questions are allowed as well. Usually when it's coming to the end, that's when people rush in with their questions. So if you have any question, I'll advise you that you bring it soon so that, when it gets to the end, we're not taking too much time to close the program. Now, this anemia question that this person keeps asking, they're saying that if they have, they're getting symptoms of anemia, so shortness of breath, tiredness, things like that, if they come to the pharmacist, can they be treated because it's just iron tablets that they're on and they need? So would they just be, or can the pharmacist just do that, basically, is the question that they're asking.
Iron tablets, you don't need prescriptions to buy them in the UK. So I
think it's if you're exempt, because I think if you're not exempt, then you have to pay for them. But if you have a prescription,
even if you're exempt, you have to pay for it because it's not a scheme. But they are quite cheap, believe you me. Depending on the pharmacy you go to. If you don't go to the very posh ones, under £5, you should get a pack of iron tablets to go home with.
Okay, thank you for the answer. I hope that answers your question. If you need any more clarification, please do text and I can clarify for you. Now, I think there's an important question in the chat.
Just about to ask. So there's a question asking if someone is under care sponsorship, does the person qualify for free medication from the pharmacy? I also believe that while answering this question, if you could also just tell us what qualifies for free medication, that will probably help.
Okay. So it's easier to read it. Care sponsorship. Is that medical exemption? Is that another name for medical exemption? What's care sponsorship?
So I think it's like, for example, if you are on a care work visa or something like a student visa, correct us if I'm wrong, if that's the question, but that's my understanding of it. So if you're like on a care work visa, like a working visa or like a student visa, I think. But yeah, that's what I mean. Yeah.
Oh, okay. Nah, it's it's not a basis for you to be exempt. It depends on your age and other conditions. So I'll just read through those ones. If you are more than 60 years or you are less than 16 years in this country, every medication that's prescribed to you is free of charge. If you are 16, 17, and 18 years, those 3 years, and you are in full-time education, again, you are exempt from paying for your medication. So if you are 16, 17, and 18, and you are not in full-time education, you need to pay for your medicines because you are eligible to work and earn money. If you've got maternity exemption, again, you don't pay for medicines. If you've got medical exemption, so there are some conditions where your GP can give you a form to fill, and from that time onwards, you are exempt from paying for medication. So a disease like diabetes, qualifies you for that. There are quite a range of diseases. The minute your GP diagnoses you, he will tell you anyway. Some people are under the Ministry of Defense. So if you serve in the British Army, most of the time you don't pay for your medication. If you are on income support or any income-based employment allowance, you're not meant to pay for your medicines. If you are on job seekers allowance from the DWP, you're not allowed to pay for medicines. If you receive tax credit, you're not allowed to pay for medicines. If you receive pension credit guarantee, you're not allowed to. And lastly, if you receive universal credit as well from the government, medicines are free of charge to you because the government recognizes that you need support.
I think you missed one as well. If you're pregnant or if you've just recently given birth up to 1 year.
Yeah, so that comes under the maternity exemption.
Oh, yeah, okay, yeah.
Together, yeah. So that's that.
Yeah.
I hope that answers your question, but we can take follow-up questions. So I've got Tilly again, and then after that I've got another question to go. So Tilly, if you can please.
All right. Thank you very much. Sorry to come back. When you mentioned about the iron tablets, the iron you can go to counter, but I have a question on that. I'm an anemic and I do take it every now and then. I'll stop from taking it. But recently my body was telling me I need it. I didn't go to the GP because I feel so tired. So I went to this pharmacy in a hospital. I don't want to mention the hospital. And the pharmacist said, it's best to not, they didn't have it then because our pharmacy and it was closed. So the hospital have their pharmacy. I rushed in there to see if I could get it. And I was advised by this person that it's best to buy it from somewhere. He wanted to write it. And I said, I know Holland and Barras sells it, and he's telling me that is better from the NHS or from the pharmacy, so he recommends. So I was using one from Holland and Barras, show him the book, he read it and he said that's the best one to be taken rather than buying from the pharmacy. And he also recommended me to add vitamin B complex. Is he right? Is he telling me the truth that those in the pharmacy are not that? It's like, I don't know. You got my question. He was recommending something outside from buying from the pharmacy. Is he right?
I'm not sure of the full conversation I had with him, but it's cheaper to buy most of those supplements from the high streets, supermarkets and Holland and Barrett, just for the cost.
Hold on. It's not about the price. It's about the product. It's not at all about the price, because if to do the price, Holland and Barrett is even expensive than the pharmacy. He is telling me there is something in it from those outside the pharmacy, like the normal pharmacy or pharmacy shop. There is something in the tablet that is not strong, but those from that Holland and Barras, he was going to write something for me to go to the internet and get it. So I was thinking, Really? And he said yes. The one I got from the Holland and Barracks is better. That's why I'm asking this question. So nothing to do with the price.
Yeah. If it's not prices, then I think it's very subjective. So there are some strengths of iron preparations that can only be in a pharmacy. So Holland and Barrett's and the supermarkets sell the weaker ones. They are not that strong. And that's for supplements. And that's what you need when you're not severely anemic. So I see where he's coming from. Maybe he thought that's severe. In that case, he was right. But if your anemia is that bad, very severe, it will be best to buy the high strength one from the pharmacy instead of to go to a Holland and Barrett one. But from what you are describing, it sounds like you take yours to prevent getting anemic on the maintenance one. So if you get it from Holland and Barrett or a pharmacy, it doesn't matter. What I would say is when you walk into a pharmacy, if you're observant, there are some preparations on some counters that you can help yourself, self-select and go and buy. Get your iron from there, it's likely to be the lower strength one. However, if you speak to a pharmacist in the dispensary, he's the strong ones there, the stronger strength ones there that he can give you for very severe anemia. So it really depends. And that will be, yeah.
Okay. All right. Thank you very much.
Yeah.
That actually brings me to this question, Kojo, and I think I know the answer, but I prefer to hear it from professionals. So, when you go, the same sort of question from Dilly, when you go to the shop and you've got like your Tesco paracetamol and it's like 50p, and then you've got like your branded paracetamol, so like your Panadol or whatever, and it's like £2.50. I mean, what's the main difference between the two medications? Why it's the same medication, but are we buying the brand, or is there actually a significant difference in the two?
Brand you're buying.
Really? Okay, maybe let me rephrase the question. I always felt that it was because the branded ones, like the more expensive ones, they worked quicker. So I felt like the Tesco ones and the cheaper ones, they even though it's the same, it almost seems like they're half-life or something. Like it takes longer to kick in, whereas some of the more expensive ones were fast acting. Is that a thing, or is that just the?
No, so yeah, the MHRA, the body that makes sure medicines are safe before they get on the market, would never allow the non-branded ones to be on the market if they are not good or effective. So once they find themselves on the shelf, they would have gone through all those tests, and I can tell you that from a clinical point of view, they are all equivalent.
As in they work within the same time. So one is not faster. What I mean is the time they use. So is one quicker acting than the other?
There are quick acting preparations you would see, especially with ibuprofen, Nurofen. They've got some gels, some soft gel ones, more soluble. So once you take it, they get absorbed quicker. But that's not a lot. You won't get a non-branded version of those ones. But say box standard, say Calpol, you paracetamol liquid, maybe 100 ml from an unknown company, or let's say Tesco's own brand. Then you've got Calpol 100 ml. They are the same. They work, their onset of action, their duration of action, everything is the same.
That's interesting. Does this apply to skincare products as well? There's no need to be paid extra.
Dr. Kojo, this is where your Ghanaian side is kicking in. But
because I didn't know Okoto paracetamol back here 50p, back here £2. So in my head, maybe it's just passive, I just also 50p there or far. Maybe it takes 1 hour or 2 hours and sana yojuma. Whereas the expensive one far, it works within 10 minutes. That's always been my sort of logic around it.
Oh, na the cost of living in this day to me cut cost no wahane ha.
Nessa Dr. Kojo Amoako na would say I academia na ya mobokra.
So Tina, you're the professional about Mr. Amoako, a pharmacist. He's explained to us there's no difference. So next time you go to the shop, don't go and pick up the most expensive drug there. Just read the contents of the drug, the ingredients, whatever. So far as it's not, you don't have anything that is allergic you are not allergic to any of the ingredients there, and it's the medication that you need, just pick it up and go.
Excellent. This is oh, wow, this is great. Good insight. I've got an anonymous question here. So a person was informed or just found out recently that they've got fat. Their fat in their liver has increased due to obesity. And I think it was recommended someone exercise it, but they want to know, sir, is there any other way apart from exercising or to add to the exercise to reduce the fat?
The only thing that comes to mind is not adding more fat, to the diet, to trying to reduce the dietary fat intake from then onwards. So there's one licensed product over the counter that one can help his or himself with in a pharmacy or speak to a pharmacist. The generic name is Allistat. I think the trade name is Ali. ALLI, I believe. What it does is, as soon as you take a very high that is very high in fat content.
Me pacho mesremo samo baswan pacho mbetumi mute mo mics no so that you don't interrupt the session that's going on, if you don't mind. Thank you.
Thank you. So it kind of prevents your system from absorbing the fats. So it goes the other way instead of getting absorbed into the bloodstream, which I think makes sense. Whilst you're trying to burn what's in there, if you're not adding more onto it helps your cause as well. So he or she can walk into a pharmacy and speak to a pharmacist whether that medicine is suitable for him or her. It's got a few exclusion criteria as well. The do's and don'ts on there. So once he ticks the boxes, it will be sold to him. And it's quite good. A lot of people speak highly of it.
Yeah. Yeah, I mean, I have nothing else to add. I think, sir, you've hit the nail on its head. I was going to say, sir, there are some prescription medications, but I don't know, before you get those prescription medications, it takes a lot in terms of, but I think Allistat, I didn't even know it was over the counter, but I know we recommend it for patients as well in terms of trying to lose body fat. So yeah, I've got nothing to add to that.
So as in any normal body fat?
It's just the body fat you need to burn in the gym.
I'm just asking for a friend.
Exercise is the top thing, but yeah, there are some additions that you can know. It wouldn't work if you don't put in the work. So you have to obviously stop eating the fat, do the exercise, and then add on the tablet. Then it helps. So the combination of the three. But if you just do the tablet alone, then you're not really, you're hitting your head against the wall.
Okay. Is it possible to please put the name of the medication in the chat, Sonia? If anybody missed that, they can sort of get that, if you don't mind. Thank you, doctor and pharmacist. Now we've got two hands raised, so we're going to start with Jonas. I want to welcome Jonas, who is a faithful watcher and has been with us for all 3 weeks. So welcome, Jonas. Thank you for joining again, and your question, please.
Jonas Akwaba, and just before you talk, just like these will be the last two questions because it's 9 o'clock, but obviously because of our faithful watcher anyway, so we will just take the last two questions and then we'll wrap it up. So yeah, Jonas Akwaba, to say.
Yeah. I mean, me question say like me TBB about scheme. Honestly, my bantem. And the scheme be see before about 8 million baby they are subscribed to the scheme, but I don't know what that scheme is because at the end it's good to know what it is so that maybe I might able to also use it. In a sapara media minya free po I'm free there can be free there no.
Hey Jonas, are they free no?
Okay, Jonas, welcome on board. I'll just summarize that for you because I'm sure that what it is is until recently, now we hear prescription to buy almost all antibiotics and antivirals from a pharmacy. It will Chrome UK. But this scheme here about single out 7 main conditions. So what's our conditions where now we age range if it's what they are meant to be. Oko pharmacy and also a doctor referral to a pharmacy and now 111 referral. The pharmacist can check you out, and if you fit whatever that scheme the inclusion criteria is, then you get an antibiotic, walk away with your treatment and start treatment straight away. And the goal is to get people to start treatment quicker instead of waiting to see a GP, and also free more GP time for more serious conditions. And so I'll just read through the 7 conditions. The first one here, asonyare, earache, Bronibeka can say otitis media. Normally, I know from 1 to 17 years. School, but it's quite common in kids. The second one here, impetigo, lesions. One quarado or my body near or man no ho, bo corner her, bo so her. And it's quite golden in color, quite soft. Nti bones a pipe and it's quite common. Nti the pharmacist can give you a cream in the pharmacy, not just what sorting out instead of going to see a GP. The next one here, toda na insect be a cow. Maybe a while summer but where you are one out a garden, na insect be a cow. Over time, the bull are infected. Not all of them get healed naturally. Now, the minute it gets infected, it can cause troubles. So when you go to a pharmacy, don't make sure, say, it's not, say, a very exotic insect. Something else could be in it, not a normal insect. And also, antibiotics will be in their mouth. The next one, unanswered, shingles, which we all know, say, it will be when you're checking pox pain. Now, occasionally, when your body defenses become weak, it manifests in the form of anansi, and most pharmacies can now treat it in the pharmacy. Now, the next one is sinusitis. So that when you're terrible cold, be normally when you're cold, within 5 to 7 days, it should self-resolve. They go on, it may go on, for a very long time. We are one years old, whatever. Look at pharmacy now or check here on this house and anyway no if he say okay, he can give you a more stronger steroid and as antibiotic depending on what he or she finds out. Or start it straight away. Now sometimes we also have minimal sore throats, very severe ones, or more mania tonsillitis pain, they can tell. Or many again. Pharmacists can now treat this and give you antibiotics within the pharmacy. And the last one here, some of the urinary tract infections. A lot of them, provided you are between 16 and 64, your age is between this, you can go to a pharmacy and under this scheme, if you tick the boxes, a pharmacist will give you antibiotics straight away, and you start taking it. So these are the 7 conditions under the scheme, and the scheme is called Pharmacy First. And that's what the UK government started. So we're rolling it out beginning of February 2024. The whole nation is warming up to it. The work I'll call GP who are offering now. Receptionists need to hear what you are saying. And receptionists need to make a referral. It saves you that trouble. And sometimes we'll call 111. They do that as well just to save the doctors. All it. That's it.
Thank you very much.
You're welcome, opinion.
Nice. I hope your question has been answered, Jonas. So I've got 2 questions here from YouTube. So I want to acknowledge our viewers from YouTube and the questions. Funny enough, the same question appears in the chat. So killing 2 birds with 1 stone. And if you are, the first question, which is a general question, if you are a 60 plus healthy female, not on any medication, do you have to take any supplements?
It might sound a bit odd coming from me, but if you eat well and you are 60 plus and healthy, you don't really need to take supplements. But academically, we are still divided or more that industry, as in those who make the supplements, they are seriously advocating that you should be taking supplements from time to time. But I belong to the other group that believes so you'll be out to meet Nasi DD, your breakfast is like a king or queen. Then you already delight every day, at least 2 square meals nicely. Kama. You don't really need to take supplements. So supplements are giving you what you don't get from your normal meal. And if you are eating well, you have time to eat well. There's no point. But when you need time to eat because of work pressures and life pressures, it's a good idea to take supplements to save you the hassle of Doc, may you be a free man?
I would like to disagree with you. You know what? Actually, I agree with you to an extent. Then there's a part. So I agree 100% with you. Say the most important thing is your meal. You need to get most of your supplement, most of your nutrition from your meal is very important. But the part where I didn't agree with you is about the supplementation, because I feel like our diets in this part of the world, and actually even the diets over the world, does not really allow for getting your full nutrition. So like if you're, and okay, I speak for myself, because I just know like even 5 fruits and vegetables cry your bread. Where to get your legumes in before you get your fiber in, before you get all that stuff in. And then think about it, in this country as well, the sun is basically non-existent. So even if you're not taking any supplement at all, as a Black person, you should be taking vitamin D regardless of your age, because there's no way you can get enough from the sun. So this is where I say I disagree with you in a way. I don't disagree with everything that you said, but I think the supplements are important. And I want to make it.
Vitamin D, I agree with you 100%. That once, you look at, for instance, phytobiotics, you look at their range, so many. Yeah. Look at Holland and Barrett, you better zinc, you better. I think that it's so there's no need personally. But vitamin D, yes, definitely. The weaker strength as maintenance, it's always a good idea.
Yeah, I think so. And especially for the older, so over 60 as well, especially if you're female, I would also always say take your calcium supplements as well, because I feel sad there. I mean, we can talk about supplements another time, and Kojo will bring you back, because you don't agree with it. I want to specifically bring you back. Because time is fast spent.
Yeah, time is fast spent. I do want to, but Patronius, I'm ignoring the Zoom for, but yeah, we tend to not acknowledge the YouTubers. So another YouTube question which I want to sort of ask, or say, are weight gaining or weight losing supplements, like, I don't know the name of this medicine, is it Ozempic?
Yeah.
Okay, so are they dangerous?
Okay. Multi-million-dollar question. So these are quite new injections that are on the market. They are biologicals, so they are not the bog standard pharmaceuticals. They contain proteins, sequenced in a special way. And normally, they are used in diabetics. So it helps bring blood sugar down. It's proven clinically it works. But miraculously, we've also realized that they help people to lose weight. So they are good for weight loss. They are good for diabetes. And for someone who is diabetic and who is big, kakra, it's perfect. You're killing 2 birds with 1 stone. But I would say, they're quite new. When we say a drug is new, say it's less than 10 years. In the humans. Until we don't have the full side effect profile of these injections yet. But so far, they are not causing so much damage. I just will be very, very worried and now, baby. But all I'll say is, because of how they work, historically, we hear other drugs that work along that axis now. They normally cause suicidal thoughts, because of that side of the brain that they work, that's it. But we don't know yet, because it's quite, and they're very good for weight loss. They're very good diabetes, sugar control, but it's quite early days yet to say, and yet, terrible side effects, and I say a year or good side effects. We will know more maybe within the next 5 years or so.
Okay, fantastic. I do hope that the questions have been answered. Really, our time is fast spent. We've got 2 hands up, Susan and Olivia. But I would like both of you to ask your questions, and then Kojo will answer them respectively, if you don't mind, since time is fast spent.
Yes. So let's start with Susan and then Olivia. So Susan, ask your question first, and then Olivia.
Yeah. Oh, time I made my it was related to Tilly's question. But your answer Bido. I think a pharmacist was kind of advising her based on the strength, because I've had that experience before. ABN could have been related with the strength of the vitamin supplements, no tono. So just like the pharmacist said, no shelves, no so dear no. Ebi wɔ hɔ a na ɛnni saa strength, but ɔkɔ ebi a independent pharmacy shop, those shops, no supplement shops, no, to say Holland and Barrett, no, benya high strength. An example is even slow release vitamin C, iron in yamanyama. Eti ebi a na no catch and say ope higher strength obetimi akɔ. However, say higher than like a certain level and a pharmacist can say pharmacists can prescribe it, or the GP can prescribe it, then you buy again from the pharmacist. So I was thinking, say, it could have been that, because I've had that experience twice, a couple of times actually, and I did a comparison and it was true. Say, I got a higher strength of those vitamins from the independent supplement shops.
Yeah. Me that's yeah, that's it. Thank you.
Okay, please, Olivia, your question.
All right, good evening.
Good evening.
I can't, for some reason, pharmacist say, the person may lose weight. Should I see the GP, or I can come see the pharmacist for him to put me on some pills to manage my weight and all that?
GP.
GP say betcha.
Yeah, betcha, papa.
After that, you will call. For yesterday, check say the bio pharmacist maybe not. Checking me BMI and now I demand to be so.
So
and I know they can
pharmacist a bit more boil with just the one fat from your diet. Right now, no sanam rana. The pharmacist cannot give you the ones to do that, but. The fat in every meal that you eat any day, the pharmacist can do that. Not just a body not handle the whole system no more already. No. And the second thing is, because these ones are new, no board in Kakra. In Kakra. If I remember, it's about 150 pounds. The board, whereas GP no a trauma, ultimately that GP no kama, no trauma. Utia for prescription. It's just £9.65,
Okay.
But these are that's what it is. Legally, we are not. And there are some online weight loss clinics. Actually, you can just do online consultation. CQC has approved them. All that. I'll be your prescription amount, and it saves you that time. If money is not an issue for you, now if it's a waiting time to see a GP in a year, a problem there. There are so many online clinics, legally accredited in the UK, competent doctors. They will send you to take blood somewhere until we be quick, and you'll be monitored.
Okay. Okay. Now, Patrol, is it the only starts? This way, can you get it over the counter?
And then a fat what no free one.
Okay.
You don't need to see a doctor for now.
Okay. All right. Okay. Thank you, sir. Thank you.
Welcome, madam.
Yeah, thank you. For William, one last question. I've got a question that says, what about collagen? And that will be the last one. I'm assuming collagen tablet.
Yeah, supplements. I did Mr. Kojo actually that said he doesn't believe in supplements.
The fact of it, I don't believe it, does not mean so you don't eat it. Say a week of collagen, but also by week of Robin when I do anything.
I think that we will do. Sorry, I think that we will do a session on where we will bring Kojo back, and then we'll talk about vitamins, because, like I said, actually, I think that no health professional can stand on. It's not black or white. So like he's saying, obviously he does believe in some supplements are definitely necessary. I think the collagen is not something that I don't buy collagen either. Like that's not a supplement that I would advise for, but I know somebody who swears by it. Yeah. So, there are pros and cons that we need to go through, but it's not something that I would say, go and have collagen. So supplement, if that makes sense. On this one, I stand with Kojo.
Okay, I think this is all we have time for. We've got again
Abna, please. Last week you were not here, Doctor. Of course, you promised me you will go and find out something and let me know this week. So can I?
With the sickle cell.
That's it. And
that's then, right. Yeah. It's because
anti-malaria. Yeah.
Yeah. So yeah, as I was saying last week, yes, when you have the sickle cell, with the trait and the sickle cell, you're not susceptible to getting malaria. So the question, just to summarize, the question was, is it true that people who have sickle cell, they usually don't get malaria, or they are highly unlikely to get malaria? And I said that it is true that people with blood disorders, especially sickle cell or sickle cell traits, that if it's unlikely for them, so it's not that it's impossible, but it's very unlikely for them to get malaria. So yeah, that is true. Naomi, I think that what I'll do is I will maybe send you some. I'll put my our contact details I'll just put them on our Instagram, TikTok, and WhatsApp number. If you're able to message me on any of those platforms, either as WhatsApp, TikTok, or Instagram, I can give you the evidence for it and like the guidelines for the sickle cell. If you want to read more about it and know exactly why that is, then I'll send it to you. So please do.
Maybe WhatsApp. I don't do any of the.
My WhatsApp is there as well.
Okay.
Yes, just details.
WhatsApp.
You, no problem. Thank you, Naomi. And they are full. And so I buy and see. Thank you for coming.
Me buy a chapana. Na me chire. Na de na muka collagen na mante de muka kosi because me koto ye on. Me koto ye me apa na me koto collagen no me no eboam kakrenti no. Senye de na yesen kamajai.
Oh, Yenka saying the question that the person asked was say supplements, which one would we recommend that over 60-year-old take, or would we even recommend say they should take any? And I think that we were saying that some of the things you don't have to take. So if, like Kojo was saying, say, share supplements, that now I'm saying there's so many supplements in zinc, magnesium, like there's so many supplements, but a lot of the supplements you don't actually need them. You can just get them from the foods that you eat. But we also agree that there are some supplements that you actually have to take, like vitamin D or calcium. You have to take them. So with collagen, we said it really depends on, not everybody needs collagen, but some people might need it depending on what their medical condition is or what they are trying to battle. So we said we'll do another session where we'll talk specifically on vitamins. We'll bring Kojo back, and then we'll talk about when you need it and when you don't need it, and if you need it at all. So yeah, so if it's working for you, don't stop it. Please take it. But we were just saying sometimes we'll be our own here, but people say, oh, collagen in tea, not all fat. I don't know, it is unnecessary. That's what we were saying. Yeah. Okay.
Yes.
I just want to
last question.
Hey, Olivia. Okay, oh dear. Last one.
Okay. Mr. Farmers, in Pacho, Renato, you walk room had here.
Renato.
Yeah, Renato cough measure, carbocysteine.
You'll be okrom.
I don't know, Tama.
I think that carbocysteine chromane by prescription only. And then there are other takes over the counter.
Over the counter. It's a call beside GP sooner on time on Trona. Can you insist so on trauma?
I doubt. It depends on the GP, but GPs they don't.
Because GP, I catch them some more cough mixture. They don't prescribe cough mixture. Go to the pharmacist. Yeah. I've been back and forth with them, and I am in one say, baby, I'm in feedback crano. Who call pharmacy crana? MCS crat me ma carbocysteine. But how they say they don't give, and I'm surprised. Meanwhile, I mean, say very good. Me babo was
yeah.
Over the counter, the other ones na boy. But I know said that particular one, I see someone prescribing, go see the pharmacist. Pharmacist no say call GP, not GP prescribing. But so far, no me who can't and so that. So that maybe sir.
It is a strong medication we usually use. I think I've only ever used it for almost like palliative patients or patients who have really bad sputum, like it's really last line. It's not something that we prescribe.
Yes.
It would be difficult to get a GP to prescribe that outside the hospital for you, because even in my experience, I've only ever prescribed it in hospital, like never outside.
Wow.
Yeah.
And Olivia, the other ones are Chrome how waiting out over the counter. They the same job amount.
Okay.
I think sir Robertson. Maybe what Robertson?
Robertson, yeah.
What chat? Why? Not
Yeah.
Okay. Yeah. Could you if you write them in the chat so that they have access to it? Okay. Well,
all right. Thank you.
Thank you so much, Olivia. I think sir we will end it here. I want to acknowledge Sally's comment where she says, Dr. Akos, thank you all for the insight and the talk. I think the time already is fast spent, and it truly is. And I will be very much interested in the talk about G6PD next time. So I am a victim with allergies to so many medicines and foods, and most of us don't know what will be good to tackle for the next time. So next time, so just like she's written in the chat, if you have any condition or if you know anybody or you just want to know more about a certain condition, please write it in the chat, because we'll make a list. We'll find a specialist and we'll bring the specialist to talk about it. So Sally, we'll get somebody who is a specialist or who's close enough to come and talk about G6PD for us. Not our immediate next one, but we'll schedule it for the next within the coming month. So thank you for that comment. And on that note, next week we'll be having Dr. Mustafa Abdul Mumin, who will join us, and he's going to talk about preventative medicine. He's a very smart doctor. In fact, we are assuming an only doctor I'm feeling so smart as me. We're very glad to have him. Unfortunately, I'm on call next Wednesday, which means I apologize to all our faithful watchers. I will not be here, but it will be next week. I won't be here because I'm on call on Wednesday. But Abena and Dr. Samini will host Dr. Abdul Mumin. So please come and or answer off. If I ask him any question, in fact, everybody come with any question that you have. He will answer it for. Honestly, that's the one doctor I'm believing about. So please come next Wednesday and come and hear that. On the other side, we have tomorrow, we have time with TAPTAP, and we'll be talking about investment. In fact, the last time I joined them was very, very informative, and it's about investing in Ghana and how it's and it's going to be with time at TAPTAP. So please join tomorrow the same time, 8 p.m. Same link, and then have conversation and learn how to you'll invest in Ghana. And on Friday we have Ask the Lawyer, again same time, same link. If you come and ask the lawyer, you can ask the lawyer any question, any immigration question. In fact, I've used him before and asked my own immigration questions. If you have family, you want to invite people, visitor visa, whatever immigration questions you have or whatever questions you have for a lawyer, come on Friday, 8 p.m. and come and ask the lawyer any question you have. Abena, have I missed anything?
I think that's about it, but I'm looking... We've got Olivia asking for pharmacist number, and I think we missed a question as well. I would like to apologize to Nancy. So, pharmacist, if you could please tell us what is the best way to contact you so that extra questions are into me and get to or anybody who has something that they want to discuss with you could sort of just say Instagram or TikTok or whichever way is best to contact you, if you don't mind dropping it in the chat for our people.
I think so. There's a phone number for where I work. It's between 10 and 6 p.m. Monday to Friday. I would put it there. Now we can pick it up from there.
Yeah. And any closing remarks for us, our dear pharmacist?
But your number now on Dr. Question, but your dear answer on there.
But what's happening, media? And our number now, could you diabetes society your non idea into 0208 number here?
And then me and Theodian made this table cacado.
Okay. And on the hay fever question, that's another tricky one, because what will work for person A might not work for person B. And it really depends on what this is Nancy. hay fever medicine I will try already because there are so many types and most people react very well to the common ones. You know? But if it is the case that we're used to the common ones, cetirizine, loratadine, there are other ones that a GP or a pharmacist can also recommend over the counter or co-pharmacist will be the GP can write stronger ones. It depends on what the person has used already, but again, it's difficult to say we know best no. Different people react differently to different medicines. So that's what I would say. But that's it.
Okay, I think as a CR we have overdone our time. Pacho, are there any closing remarks from Dr. And I think the pharmacist Kojo is done.
Yeah, so no, nothing from me. It's just join us next week, same time. And if you have any questions or any general health questions, please remember this is the place to ask it. This is a health talk. Every question is allowed. No question is too embarrassing. And if you find that you don't want to ask, you can always private message us on the chat or our contact details. So please welcome, come everybody, come next week and join us for OT Health Talk. Thank you.
Yeah, and our information is in the chat, so you can follow our various pages as well, and also follow OT Media and TAPTAP Cent who sponsor this. And yeah, see you next week. Thank you.
Bye.
Thank you and good night all.
Good night. Have a good week.
London, it's your time and your turn. Shades of Grace Movie Premiere UK 2024. Taking place at the Odeon Cinema, Greenwich, Buxby Way, London, SC10 OQJ. Grab your tickets at www.dpgministry.com. It's happening on Saturday, 25th of May, 2024. London, it's your time and it's your turn. We can't wait to see you there. It's going to be an amazing night. You can't afford to miss this. To God be all the glory.
Onyeji cash, chopping and spending the cash. No mercy for money. You don't cost. Last. Now everybody go job breakfast.
See with the eye of the spirit, and I can tell joy is far from you. Prayed, you have wept, you have fasted, you have travailed. Now it's time to rest in the faith that God is not a man that he should lie.
Hello, this is Lawyer Wisdom of Wismart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
Buy an interest-free home and pay within 36 months. Yes, Daimler Homes' new gold standard development, Hilton Court, has just commenced, and you can own a unit now and pay within 36 months without any interest. Starting at 95,000, you can own an elegant apartment. And guess what? Discounts are available from now till end of May. To learn more, visit our website at daimlerhomesgh.com or call us on 0200-584-558. Daimler Homes, the elegance of living.
Mr. Mankwa, me offer was a niska bani de awie ni project no. Eso de bia me offer sika ma ne wo problem.
Enemremu. Na monte tap send nka.
No so ne de.
Tap send dey easy, fast and secured way. Ubetimi send this free amanone. Aba Ghana bank account and as a mobile money account. Untia transfer fee bia.
Sir, I obey any say.
Chene say won call App Store na Play Store. On download the tap send app no. Or download ya. Ebebu sanso promo code. Oma the pet TV shim. Obenya 5 euros, 5 pounds, and answer $10 on his first transfer.
And you make kwa friend a catch them.
Tabi minyanwe. Esan say TAPTAP send at the good news aba. TAPTAP send the the customers won't or the TAPTAP send wallet aba.
I know about any say.
So your customer who you cases here. Ubetimi akọ TAPTAP send app no create wallet wo so. Enti se rate ne kosora now the sika kogu wallet no. Anase mpo obetimi atosusu nkakra. Enti abre sem a opeso send sika ba Ghana no. No anse wa send sika na ba Ghana. Anase oba o my Ghana mu a watimi use sika e wo wallet no no. Tie.
And you said to say you use momo Ghana hey no.
Sa pepe. Se si TAPTAP send that trainer shim. Kopiem wo United Arab Emirates, Netherlands and Austria. TAPTAP send na.
Papa no.